Healthcare supply chain modeling and analytics, as ma'am has given me the topic, and I'm very grateful that ma'am approached me and she actually asked me. So you have to give a session on healthcare supply chain modeling and analytics, and you can cover the system thinking approach also in that. So keeping that in view, because one of the course objective was to understand dynamic systems, supply chain dynamics. So that I will try to address. The agenda for today is understanding healthcare systems and supply chain, of course. Um, Healthcare supply chain characteristics, different type of healthcare supply chain. Of course, there will be two supply chain which are very much in discussion these days, and a lot of research are being done in that area. One is vaccine supply chain, and other is because of chronic disease are on rise, there is a insulin supply chain. And these two supply chains have a inherent complexity. We will discuss that and what we understand by complexity and what are the complexity challenges in supply chain, how to address that, how one of the case organization address that, can we implement that in our organizations also. So it will be more kind of discussion, and ma'am has given 30 minutes of time for discussion, but you can interrupt me anytime, we can discuss. And then managing disruptions, we will discuss the causes, stress test, digital twin, what is inventory control system as one of the lever for addressing uncertainty in supply chain. And then of course, in the end or in second part of the today's session, we will discuss supply chain dynamics using system dynamics modeling, and we will do some hand-on, means some small models, and we'll try to build on over that. And in case in future, if you are doing any research using system approach in supply chain, I will be always there with you, and I will be happy to learn and implement projects with you. So first, we will start with what all of we know, and that is actually transformation process view. Everyone is taught about this. You in your classes also actually teach about this, that operation is a transformation process where we are transforming input into outputs. Okay, so that is the thing. So because we are discussing healthcare supply chain today, can any one of you means tell me what we transform in case of healthcare? Anyone? There are 22 participants. So any one of you say, means it's more like discussion. We will slowly, we will discuss things, then we'll, on the basis of your suggestion or question, we will move ahead, and then we will summarize thing, and then we'll move to next module. So what we are transforming in case of healthcare?
Good evening,
Hi,
sir.
sir.
Yes, ma'am.
This is
Meenakshi.
Meenakshi. I
Yeah.
want to answer.
Yes.
Yeah. In transformation process in healthcare sector, this is means if there is any patient and he is or she is suffering any disease, that is input. And when we are just giving him or her treatment and he is just feeling well, and we are just giving medicines or anything else, what he can just cure himself or herself. This is output in that case.
Great, bang on. So we are actually transforming physiological states of a patient into a better physiological state or health, we can say. That may be anything, that may be either physical, mental, or social well-being. So that transformation is being done through our healthcare. So this is transformation process, and this transformation process is actually part of a thing which is called system. So a system is an overall thing or a core element, and there how it works, that is actually process. So process are all the things you do in order to make any given system work most efficiently. So mostly we discuss about processes, we try to improve processes, but we never talk about system approach of supply chain. And when there are supply chain which are having inherent a complexity, we will discuss what is difference between complexity and what is complexity and what is complication. These two are very different terms, and That we will come to that. So before that, processes are important. We were optimizing processes, and that was considered to be a soft system thinking approach, a hard system thinking approach. Now we will talk about system thinking approach, how to take a holistic view of when we are not going to optimize at a minute level, but we are getting a feel of a whole system and we are strategizing according to that. So whenever you are making a strategy, minute information are not that important, but a holistic information becomes very, very important. And the system thinking approach comes into picture. So we will go there slowly, we will build on that. Before that, uh, this is from the transformation process. Now we have made it little more complex. There is a patient, there is a health service agent, there is a money, their services are getting delivered, then request for services are there, money is coming from outside also in terms of government funds, in terms of other financing mechanism, not only out of pocket spend, but other things also. This forms healthcare system. Is this healthcare system this much complex? No. So my question again, the thing is complexity good or bad? Anyone? Is complexity good or bad?
As long as it is serving the purpose, desired purpose, and at the optimum cost and optimum quality, it is good. Else, it is a waste.
Very good. First portion of Dr. Chaturvedi was exactly right. Complexity we cannot remove. We actually talk about in our daily life also. We never say don't make things complex. We say don't make things complicated. Means complex we are. All human systems are, or all social systems are complex. We cannot do away with complexity, but yes, we can make them less complicated. So whenever, and complexity, the drivers are many. Like if for context of supply chain, if you are saying, if a supply chain is complex, it is serving many purpose. So if a thing is not very means not complex at a desired level, maybe it will not be serving that purpose, that very purpose. You can think about like suppose you develop a model. It's a very basic model. You cannot get some insight from that, but you make it a little more complicated, more complex. You get some inference from there. Complication is adding undesired elements in a system. So we will not try to not to complicate things, but complexity we cannot avoid. So it will be there. See, making little more complex. Physician is there. We were initially defined process, then we saw a system approach, then there is physician, then pharmacist, allied healthcare patient, administrator, nurse. These all are interacting, and there one term is written, and that is non-linear interaction. Non-linear interaction is there. We always in our optimization talk about linear interaction. We develop model linear optimization. We never talk about non-linear interaction. Here there are non-linear interaction, and then again one thing which is shown by arrow there on top of that, changing environment. And from there, the term which is changing, we called it dynamic. The thing which is changing with time is called dynamic. So not only the things become complex, they are, the dynamic complexity is there. So for supply chain of healthcare, many elements are there. They are working together. One element is affecting other. Even you don't know, even at element level, that element or that organization don't know how supply chain works, but collectively they are doing wonder. And that is the beauty. Like in human body also, uh, when you talk about a function, organ, that will be that is functioning in certain fashion, but the body as a whole is working wonderfully. It is means the goal is higher than that. So elements form systems, that is thing. In supply chain also, different entities are different elements, and they collectively form systems. And again thing is what we discussed, complexity we cannot avoid, so this system is complex system. Now the other thing is this system is complex dynamic system. The supply chain is complex dynamic system in healthcare. And another one term which I want to add, that is adaptive. Means any system learns. So with there will be one event like COVID happened, supply chain will learn how to respond that. So now the healthcare system which we are going to discuss in terms of supply chain, that is not only complex, that is not only means dynamic, but that is adaptive also. So complex, dynamic, adaptive system we are talking about, and that we will discuss today. And later we will try to model also small system. Can you figure out what this is in these figures? What these images are for?
The first one is a group of birds, I think.
One is yeah, the birds are flocking together, and other is
This is a group of fishes.
these are school of fishes. Yes,
Yeah.
exactly right. You are. So see, one of each word is actually a system. Each word is actually a system, like a organization in supply chain. Do you know whether bird is having idea that they are flying in such a pattern? How this works? Means, do a fish know that they are swimming in a school kind of group? Do they know this?
No, sir. They just follow each other.
They just follow each other. This is exactly right. Who answered that?
Lakshmi.
Yes, great Lakshmi. So they follow each other. Do they follow their leader? Is there any leader?
Not
Yes, sir.
necessarily.
Not compulsorily, but usually they have.
Some cases they have. Most of the cases they don't have.
Yes, sir.
What they do simple things. They do simple things. If their neighbor is moving in another direction, they will move in that direction. Okay? So they just try to optimize or try to work in certain rules around themselves. And the resultant is wonderful. A school, means a pattern of birds flocking together. So that's the supply chain also works, or that's where a system also works. Actually, the entities or elements don't know what their resultant is going to be. It's not 1 + 1 is equal to 2 kind of thing. In system approach of supply chain or anything, we always talk about 1 + 1 is greater than 2. It is more than that. And in this case, only the fish, this bird, they don't know whether they are flying in flocking together or they are swimming in a pool. Actually, they are. And that is beauty of a system. This is actually epitome of a system approach. Now, because we are having a class or a session on modeling and analytics, the mathematician role is now changed. Some 2,500 years before it changed. No geography, no geometry. Now we are talking about no algebra. If you combine algebra and geometry, it becomes like coordinate geometry. So these things we already have mastered, used, analyzed. Now the thing is, the role of mathematician is not now limited to numbers or algebra. Now see, their work is study of patterns, and that exactly I want to sensitize this class with. You as a supply chain, your role is not number crunching or doing something in Excel and finding out that this is the optimum solution. The coordinate of this facility should be this.